The Epilepsy Foundation is the single most important factor for all people with epilepsy in this country.
The Epilepsy Foundation is a 50-year-old institution in the United States that serves people with epilepsy. Our mission is to lead the fight to overcome the challenges created by epilepsy and to accelerate therapies that stop seizures, find cures, and save lives. I believe conferences, anytime you can bring people together to share best practices, to learn from each other, you can really accelerate your mission. And our national meeting brings forward not only our staff leadership, but our volunteer board leaders so that we can begin to think about how we can use the relationships we have across the country and leverage our resources to make a bigger impact.
I think that the beauty in it all is that it doesn't matter where we come from in the world, it doesn't matter what we look like, we're not caught up in socioeconomic status. When we're standing in the room, we're all purple. We're all purple, so.
Epilepsy is a very common disease. 3.4 million people in the United States are affected by epilepsy.
The National Epilepsy Education and Awareness Collaborative is a community of practice with stakeholders that work with people with epilepsy and those who don't normally work with people with epilepsy. And the goals are to improve a competent workforce, improve self-management skills among people with epilepsy, and providing general education and public awareness about epilepsy to reduce stigma and get rid of some of those myths that people have about the condition.
And it's up to us at the foundation to educate the public about the different types of seizures. For an example, a seizure can be something just as simple as a stare, or someone may wonder, or someone may lose their train of thought. So those are focal seizures. And then the one that most people think of is the generalized tonic-clonic seizure that has a stiffening and shaking.
So there's 3 basic steps to first aid that anyone can do to help someone having a seizure, regardless of what type of seizure it is. The first step is you want to stay with the person. The second step is you want to keep them safe. The final step is if the person is having a tonic-clonic seizure, turn them on their side so that they don't choke and they don't have trouble breathing. And following those steps, anyone can help someone having a seizure.
The Epilepsy Foundation is committed to ending epilepsy. We all want to be out of a job someday, right? But ending epilepsy also means ending the misinformation that so many people have about epilepsy.
We work to ensure a competent workforce, and the way that is implemented, we train primary care providers by epilepsy specialists so that they know the latest treatment for epilepsy.
So, a big focus and interest of mine in my career has been looking at quality of care that we provide to people with epilepsy. I think it's very easy for physicians sometimes to get excessively focused on the idea that treating epilepsy is just about reducing the number of seizures. And it's really critical, I think, that we realize it's about so much more than that.
So care coordination also means organizing all the different types of care people need. There's your medical care, but there's also what you need to learn how to manage your epilepsy, to live life at home. How do you deal with depression or other problems or cognitive problems that you might have? So the Epilepsy Foundation provides grants and services to our local network to train them in self-management programs that have been tested for people with epilepsy.
In Arizona, we provide all the awareness services, training services, and different programs for people with epilepsy. One of our best programs that we're known for is called Camp Candlelight. Most parents of children with epilepsy don't want to have their children gone from them for a whole entire week. But we have pediatric epileptologists there, we have nurses who specialize in epilepsy there, so we tell them that they have better care and they're safer at camp because they have 24-hour care there. But the kids really love it because it's the first time that they meet other kids with epilepsy.
And so the network is the most powerful thing that the foundation brings to the table, an opportunity to just authentically be ourselves, to come to conferences, to be at meetings, to share our stories and hear the stories of so many others.
I'd say my favorite part about the job is working with newly diagnosed kids with epilepsy. I was diagnosed with epilepsy when I was 19, and so it's just great to be able to talk to the kids, especially young girls, and just give them hope.
Our wealth as an organization is not what makes us rich, and our ability to provide content isn't what makes us strong. It's really our people. It's the leaders that have a bond together, that no matter where you are in the country, you're going to get the care you deserve, and that we're going to be able to provide answers and change fear and isolation and transform that into hope and inspiration.